Marhaba. Hello and welcome everyone to this webinar organized by Medoment on the uses of technologies to enhance healthcare and maximize patient engagement. My name is Vivian Mendonça. I am a dentist and writer on healthcare topics based in Dubai. I'd like to extend a warm welcome to our expert panelists, who I will introduce in a moment, and to everyone watching. Welcome. The use of information and communication technologies in healthcare is increasing, and this trend has been accelerated by the COVID-19 pandemic. In this webinar, we will discuss the challenges of integrating new technologies into practice and how providers can maximize patient engagement to deliver the best possible care. If you have any questions during the webinar, please type these into the chat box and we will try to address as many as possible at the end. It gives me great pleasure to introduce our panelists, who are all leaders in their respective fields in healthcare and technology. First, a warm welcome to Dr. Fatin Al-Malaim. Dr. Fatin is the CEO of Hadi Clinic, one of the oldest private hospitals in Kuwait. The Hadi Clinic remains at the forefront of medical innovation, incorporating the latest technologies within a holistic philosophy of healthcare. Dr. Fatin is also an entrepreneur, chairman and founder of the Baccarat Wellness Center, as well as an artist, certified yoga instructor, and trainer for mind map and creative thinking. She is a John Maxwell certified speaker, trainer, and coach. She has a huge passion for everything related to health and wellness. Welcome, Dr. Fatin.
Thank you.
Next, I would like to welcome Dr. Rahul Goyal. Dr. Rahul is a UK-trained consultant in family medicine, now based in the UAE, with over 20 years' experience in family medicine, and he has also completed his specialist training in ophthalmology. He is Senior Vice President of Clinical Engagement for Malafi, the region's first health information exchange platform. Malafi will safely and securely connect all healthcare providers, public and private, in the Emirate of Abu Dhabi. Dr. Rahul is also an adjunct clinical professor at Mohammed bin Rashid University of Medicine and Health Sciences in Dubai. Previously, he was lead physician for informatics for Mediclinic Middle East and was involved in various healthcare information and digital transformation projects, promoting physician-focused adoption. Dr. Rahul was elected one of Future 50 clinical leaders in healthcare IT by HIMSS in 2019. Welcome, Dr. Rahul.
Thank you, Vivian.
We also give a warm welcome to Mr. Abdulaziz Al-Khaif. Mr. Abdulaziz is Chief Information Officer at Dr. Abdul Rahman Al-Mashari Hospital in Riyadh, Saudi Arabia. Mr. Abdulaziz has been working in the IT management field for over 24 years and has extensive experience in healthcare information technology. He is an expert in the logistics and delivery of digital transformation for hospitals. Mr. Abdulaziz also contributes his expertise to local and international healthcare technology interest groups and has previously spoken at many webinars and events in the region. Welcome, Mr. Abdulaziz.
Thank you.
And finally, we welcome Mr. Ajwad Kader. Mr. Ajwad is a founder and the CEO of HT Works. He is an experienced leader with a proven ability to deliver high-value projects. He specializes in healthcare informatics consultancy, project management, and organizational change management. He and his team at HT Works built Medoment, a complete solution to enhance healthcare delivery through increased reach and patient engagement. Mr. Ajwad has over 20 years' experience of working with world-class health information management systems. He leads digital transformation projects, achieving the highest levels of adoption and return on investment. including the first HIMSS Level 6 hospital in the UAE and the first HIMSS Level 7 hospital in the Middle East. Welcome, Mr. Ajwad. And thank you to all our panelists for participating in this webinar and sharing your expertise with us. So I'd like to ask the first question to Dr. Fatton. Dr. Fatton, from a hospital CEO's perspective, how important is it that a hospital management solution ensures wider reach and engagement with patients?
Thank you, Vivian, for the lovely introduction. And, you know, just in one word, I don't think anyone can live without the technology now, specifically the HMIS system. We started, you know, in Hadi Clinic in 2002, and that was the first version of the hospital management information system that we embarked on. At that time, hospitals, you know, I remember visiting hospital. Rarely there was any hospital that they have the full information management system. There was fragmented modules like pharmacy and finance and what have you, but none of them has anyone. I remember traveling to Mallorca at that time, and they were commissioning the first Thurner at that time, you know, and it was really impressive. And I've seen results there, you know, they showed me how it helped. So now I don't think that we can live without hospital management information system. Personally in Hadi, it did tremendous help in terms of efficiency, patient's outcome, easy access, enhance patient satisfaction. I mean, it's a paramount now for any hospital, and I don't think we can live without it.
Yeah, thank you. This is true. If I can just ask Dr. Rahul next, what are the challenges that clinicians face when working on multiple IT systems, and how do these challenges affect patient engagement?
Thanks, Vivian. Thanks for the introduction initially. So yes, that's always a challenge with clinicians, and one of the major causes of burnout as well. Presenting physicians multiple portals to do duplication of work. So there is this phenomena of FaceTime with your patient, which is of paramount importance. The FaceTime to the patient that you're listening and you're imparting advice and counsel is as important as the management plan itself. Now, any workflow that takes you away from that FaceTime impedes that relationship. There are well-known portals that every clinician comes across, issuing a sick leave, doing a notification of any disease to the government agencies or to the internal admins, getting out of the workflow to do medication management. Those are the workflows that are laden with risk because they take your focus away from the patient and involve you in menial admin tasks, if you like. So it's quite important that whenever we introduce a workflow, it has to be seamless within the workflow of the clinician and the patients, keeping them in mind. And not only them, there is a workflow that there is from the triage from the nurses, when the doctor sees the patients, and the safe disposition of the patient outside the doctor's consulting room. So it's very important to map all those workflows, make sure you're not interfering with them, adding layers on them, or time to them. Now, doctors are very particular about, at times, well, most of the doctors that I've met, but you know what, that functionality that you added last time has increased my 6 clicks per patient. Now, this is important. For a doctor to say that is important, that they've taken the time to count the number of extra clicks they've had to do, means that they don't want it. There's always a balance between what value add it provides and the extra work that we ask the clinicians to do on that. And that needs to be mapped. They need to lead it from a clinical perspective, why it's required, and then they need to champion it to the workflows. I think it's also important to make sure that the patients understand initially, if there is any new workflow that goes on, what impact it would have on that particular day and their care, the positives initially, so that they understand why we are doing it. I think that's basically my summary of what really involves workflow redesign and why. I think why is very important, why we need to do it.
Yes. Yes. So you are very much getting the views of the doctors that you're working with on how the work.
Correct.
Working
Not to do it for the heck of doing it, but why are we doing it is important. And then taking them with us in the design process, because they know their workflows better than any one of us can pretend to.
Yes. Okay. That's great. Okay. Thank you. So if I can move on to Mr. Abdulaziz, I'd like to ask, as a CIO, what would you consider as important when selecting a healthcare solution that will help both care providers and care seekers at the same time?
Well, whenever we are looking at any given system inside the hospital, seamless is the word that we are always thinking of. So the workflows that being designed in those systems need to be in line with the whatever is being done inside the patient journey. So patient safety and smooth of operation is the two main subject that we are always looking at. Now, saying that, any system, any given system that will facilitate the work for the workforce inside the operation side is much, welcome and will be sought. But we always have to keep in mind that the workplace of the clinician is not only governed for what need to be done, but also the governance rule that will dictate that certain things need to be done first, then the second and third. So we are trying to help those workers in the operations side to go through those activities as smoothly as possible without going back in history that's patient safety related. So if you're doing the process, you have to do it in the first place, in the right place, in the right time, without fail. That's the whole purpose of having those workflows and those HIS systems. I just need to cover back the word from our colleagues that HIS system and other management system are there to support the clinician and the workforce in any given care facility. Seamless is also something that we always look for in any given technology. We don't want to hassle people to do their work. We want to facilitate, we want to make it easy. Changes is a must in this world, but the not deviating from the practices that being already established is something very, very important for us to look into any given system. Thank you.
Yes. Oh, okay. Thank you. That's really helpful. If we can move on, Mr. Ajwat, if I can just ask you, what features of Medoment do you think enhance patient care and engagement?
Yeah, thank you, Vivian. Thank you for the introduction. And I'm learning a lot from the panelists as well. So as the topic, the patient engagement, that really matches with Medoment vision, product vision as well. The overall vision of Medoment product is to enhance patient and care provider engagement. That is to give a platform where a single platform at any care settings for the care provider and the patients to be able to interact, engage in order to drive better healthcare outcomes. So keeping in this mind, we have thought about different care settings. Of course, we have to start somewhere. So if you take the different main features, of course, if I am to cover all the features, it's not going to be enough. This time is not going to be enough. So I'll go very brief. So one of the functionality or the area of Medoment is to allow the patients to be able to search and find a doctor when they are in a need to book a consultation online using any of the devices that they have, whether it is mobile or a laptop or a tab. And based on their preferences, locations, the specialty, or any other preferences, they can find a doctor. they can directly book a consultation with a doctor in any of the care providers that who's connected to Medoment. And then from there onwards, they can manage the whole consultation on their mobile device, including giving the confirmation, or if they need to reschedule the appointment or cancel the appointment. And then when they visit the facility, they can check in using the mobile and then go through the whole workflow of the consultation. So that's one area. And another major area is, of course, today's hot topic everywhere is the teleconsultation or telemedicine. So the Medoment has the complete teleconsultation platform end to end, covering all the required steps in a consultation journey, just almost imitating a consultation workflow that will happen physically, including the waiting rooms and different status updates, etc. And this is all done in a secured way. And when we talk about the teleconsultations, I think important thing is the security, because the privacy of the patient and the data shared needs to be really secured. So we have made sure that our solutions are HIPAA compliant and secured as well. Apart from that, we also have the personal health record platform where the patient can have access to their health records, whether it is the prescriptions or the lab results, x-rays, etc., on their mobile device. And then there are different use cases for this, like including sharing that information for a second opinion, etc., those workflows as well. Plus a few other things, like the vaccination records, refill requests, and all this data that are related to the health record as well. And we are currently working on remote device integrations to integrate the wearable devices and remote patient monitoring devices into Medoment, so that patient can feed those data into the system, and through that go into the hospital information systems in the care provider's system. So it is fully integrated with it's fully integratable with any hospital information systems to exchange this information between what is inside the hospital and what is coming from the patient.
That's great. So everything can be integrated into the same platform to make it, as we said before, seamless. That's good.
Yeah, like Dr. Rahul said, the doctors or the clinicians don't want to be restricted by the technology, but they need to be empowered to do more with the technology. So that's something that we have kept in mind.
Yeah, thank you, Mr. Ajwad. Okay, we'll just go back to Dr. Fatten. Your family having pioneered the first private hospital in Kuwait, and the way you've taken it forward with an increased emphasis on quality of life for patients as well as health professionals is remarkable. How do you see a user-friendly and effective teleconsultation solution improving the quality of life for hospital staff and for the care given to your patients?
It's really very important, especially now, even with COVID and teleconsultation is, because what I can see now, even within the staff and the patient, is a huge fear coming to any healthcare providers because of COVID and the transmission of this disease. And with consultation within their comfort at home, they can do it. And we already have it now within our facility. And, also because we embarked on integrative medicine, which is holistic health, which is my passion, plus the Western medicine, with high technology and the use of even their mobile, they can just hook it with any artificial intelligence, and they can, within the comfort of their home, to practice all the modality that goes hand in hand with holistic health. So, for example, if they part of their treatment plan is meditation or yoga practices, or they can just hook it to any app and they can practice and then just hook it to our HMIS system, and it will be there for their physician. So just to ensure, holistic health, because I think Western medicine now precisely is not enough. And with the help of technology, we can ensure both Western medicine in addition to holistic health. with the help of the integration of all the modality within that practice.
Yes, that's very good. And yeah, so you're finding that teleconsultation is really assisting in this holistic care.
For both, for the
Yes.
typical patients that they don't want actually to come to the hospital, and for burned out even physician, with the comfort, even at their home, they can just hook to the system and they can do teleconsultation. And with a platform that have everything, they can do informed decisions for the patient.
Yes, okay, that's great, thank you. So next, if I can ask Dr. Rahul, from your experience, how important is it for patients to interact beyond the consultation episode? So things like secure direct messaging and other ways they might want to interact.
Thanks, Lavinia. That's a very pertinent question here. Speaking of workflows and involving patients. So essentially, if you look at the exchange between the physician and the patient should be at the center of it. There are a lot of publications and articles on how much information a patient retains once the patient exits the doctor's consulting room. And worryingly, that's about 50% or less. So whatever you say, divided by half, and that's what the patient will retain after the patient leaves your room. What happens in the 3 months that you see the patient again? Your chronic disease patients, I'll take an example of what happens in the meanwhile. From that fractured piece of information that they take outside your room, retain it, 50%, and then what do they do with it before they come and see you back? Now, how can you reinforce the message that you passed in the clinic? You can't take a highlighter and put bold letters on the ones that were more important in the chat that you had, unfortunately. There are ways to do that. Patient portals are a great way of doing that, keeping patients engaged. Again, there is a lot of evidence that suggests, keeping on the theme of the chronic disease, patients who are diabetic and have a patient portal access, the glycemic control was about 30% better than patients who didn't have access. Now, how does that help? Simple example is patients get a feedback. They get their lab results. They know that in the patient portal, what is considered to be normal. So if my HbA1c, for example, is below 6.5%, that my doctor says is good control. Where am I? I'm 7. Okay. So what the nurse and the doc told me about diet and lifestyle, let me give it a go. If they see that peak falling to below 6.5 and better, you have a very engaged patient. Do you have a feedback for the patient to say it's directly related to the healthcare advice, and if your diet and your lifestyle improves, your outcomes improve? It's also an important message for the patient to understand what diabetes is. Now, 7 out of 10, when I see patients in my clinic and I ask them, so what is it that you take for your diabetes? And the answer is, I take 5 tabs, doc. Take your pick, which one is the one for diabetes. Because that discussion hasn't happened, and I take it as a weakness from our side, from a clinician side, that we didn't explain it well enough. How can we do that? We link, so again, on a portal, if you can link a disease group to a medication list, they can easily identify, these are the medications I take for my diabetes. It's an important communication between the physician and the patient to continue outside the room. Same goes as, so I'm outside the room now, I want to see the doc again. How can I book an appointment without having to wait online? I want to be able to do it on my mobile. I call it the Uberization of medicine, but that's exactly what it is. So our patients expect that basic minimum from us. They want information at the touch of a button. They want the information in their pockets, and they want to interact with their healthcare providers on a mobile. And you need to now think of, so technology is the easy bit. Technology is the easy bit in the sense of, you know what they want, just go and do it. So technology is not the exciting bit. The exciting bit is what it enables outside and inside the consulting room. if you like.
Yeah, thank you. Sorry,
yes.
I might have to move on to the next question, but it's really interesting what you're talking about, empowering patients to take control of their own health. I can really see the benefits of that. And as you see, in other areas, people are used to having instant access in areas outside healthcare, and it's patients would expect a bit more, from the healthcare providers, and this enables it. Okay, if I can just move on to Mr. Abdulaziz. Availability and accessibility of data is essential for both care providers and care seekers if a solution is to be effective. What would you look for in a patient engagement solution to ensure data security and privacy?
Well, the thing is about information is without being shared is useless. So when we're talking about those requirements that we look for in any system regarding the information is something in a concept like just-in-time information. So to be useful, to be relevant as a system, you have to provide the relevant information at the right time for the clinician. That being said, the clinician side, they want to take those action, decision, and process the treatment. From the other side, it's the same thing. Patient, they are engaged if they are satisfied with the information at that particular time. To capture some talk from the marketing side, is said if you identify that moment of engagement that will add value to the customer or otherwise, that's when you have the most benefit of information. So that identification of moment that will interact between the person, the customer, the patient, or and the system is the target of any information management system. That's what should be. Now, to automate that and to align it with proven medical practices, proven patient education pathways. So if we merge those with technology that is reliable, it's just the best of two worlds. As informatics always say that technology plus human equals something greater than both of them. Though that's what we are trying to achieve and what we're looking for in any system. Now, if we could identify those moments, provide them to the patient, they will be more engaged because we identify useful moment, useful information for them. As doctor has been talking to us about, if we give the relevant information for that diabetes patient or any chronic disease, then it will be useful. He will be connected to this application, to be connected to this system. He will get benefit from it. We need to extend or augment the actual mind of the patient with technology. Remind them of doing one thing or another. Remind them of not doing. Check up on them, and as measurements say, if you are above that, you're okay. If you're below that, you need to be engaging with a healthcare provider. So those type of pull information from the side of the patient is, I think, the whole point of having an engagement software. Patient will pull information. No longer they will be pushed to get information from the care provider. They are more aware about their situation. They are more aware. They are feeling the pain. They are feeling the symptom. So when they do and fail it, they will seek this information. And if we have those information and action to be delivered to them at that moment, that is the perfect merger between technology and the actual management of disease.
Yes, thank you. Could I just ask you to mention something about data security and data protection?
Well, again, sorry, I just jumped.
Yeah.
The security is always a saw between accessibility and security. Security of information, we also need to have evolve. It will be evolved in the next phase, identifying relevant information that will affect the safety of the patient, and then irrelevant or general information. Now, that distinction between the two will give us more flexibility. What would be deemed secure or need to be secure, and what need to be public? We don't need to worry about it. That's identifying those medical content, education content that is not identifying the patient himself. So if that is identified, then we could, shield those information that will affect the patient by himself, and then the other is less, level of security. Now, securing those in the latest and greatest technology and encryption is also a major, concern for all care provider, in which, side you will look at it. The thing is that identifying those type of information and their level of security is one of the major factor, and one of the major challenges that any, parties that seeking to implement systems, they will have in their mind. We need to have those in a very tight, secure place, and the other side of the information is readily of proof. That distinction will give us a strategy of how to deal with security of information.
Yes. Okay. Thank you. Yeah, that's very helpful. So just another question to Mr. Ajwad. What are the main reasons that inspired you and your company to develop and launch Medoment?
Thanks, Vivian. Yeah, I think like when I am listening to the rest of the panelists, it's very clear that the patient engagement is key, and moving forward, the demand for the patient engagement is only going to increase. If you see today, we talk with our fingers than we talk with our normal communication methods. Like, like we used to talk, we used to call. Nowadays, we are more comfortable to go online, chat on WhatsApp, than calling someone for a small exchange of information. With all this trend, it is very clear that the technology and the patient engagement is going to demand of platform that are holistic or comprehensive, that covers all the sides of the patient engagement. So me and my team, if you take, we have been in the healthcare informatics domain for a long time. So within combined experience, we have almost close to 100 years of experience in healthcare. So obviously, we wanted to be focused in healthcare. But when I look at the field of healthcare informatics, hospital information systems, there are plenty. There are really good, great hospital information systems. But what we saw is that one single platform that connects the inside of the hospital systems and the clinicians and the staff inside the care provider organizations to the patients or the care seekers and their relatives is very important. Of course, there are many, but from experience, from our experience, we saw there is a need to have a single platform that covers all care settings, and that allows both care providers and care seekers to have a single platform to enhance their patient or healthcare outcomes. So, of course, we have to look at different care settings. So outpatient or the consultation care settings, the way the interaction that needs to happen is different. Most probably the consultation time is 5 to 10, 15 minutes max usually. So like Dr. Rahul said, I was actually really surprised that the patient only retained 50% of the information that the clinician wants to communicate. That's actually an alarming statistics, especially when you look at especially elderly patients who may even retain less information, because that probably is an average between all the demographics of the patient. So the elderly patients may need more reminders and engagement from the clinicians and the care provider sides than younger patients. And the chronic patients may need a continuous engagement with their care settings. So we have taken all this into consideration, and we thought we will come up with a product that will allow the care seeker and the care provider to have a better engagement while giving the best of technology to do that with ease. So that's what was our initial thought and the passion that enabled or that moved us towards the Medoment product.
Yes. Okay, thank you. We are taking some questions from people watching. Actually have one question for you, Mr. Ajwad. Can hospital and clinics request for a project demonstration of Medoment?
Oh, yes, of course. That is something that we would really welcome from the hospitals and any type of care setting. So one thing that I would like to mention is Medoment is developed with the aim to cater all type of healthcare organizations. So whether it is a smaller clinic or a large group of hospital expanding over the whole country, Medoment can fit into any type of organization. So it can be for a hospital, clinic, care homes, and remote clinics as well. So we, of course, we would welcome the opportunity to show our product and showcase our product.
Yes, thank you. Not sure how much time we have left. Should I ask one more question? I'll ask Dr. Fatin. As the costs of healthcare provision keep increasing, as a CEO of a hospital, how do you think innovation in technology balances the cost of providing efficient healthcare to your patients? How do you balance the cost of technology and in making things more efficient?
It plays a huge role, actually. You know, at the beginning, the hospital might think, or the management, that the cost of technology is really high, especially if they are gonna find a good systems. Yet, on the long run, they will benefit much more than the cost that they endure, because it will help them into that platform that have all the key performance indicators. It will help top managements to make informed decisions. Like, for example, even workload assessments, you know, and distribution, fairly staffing. It helps us a lot, you know, also assessing needs for patients and then providing the suitable um, uh, physicians or services for the patients. Without the technology, honestly speaking, I think 25 years ago, we will not be able to decide that fast. So does it help? It helped tremendously. We've seen it. We are practicing it since 25 years ago, and it truly will pay back. Yes.
Yes, thank you. So I think we've seen the benefits of technology and how it can be integrated into the healthcare practice, so that it's not actually a burden, but it's actually assisting healthcare providers to have a seamless workflow. Does anyone have any comments before we close? Anything you'd like to add?
Just one thing, Vivian. Dr. Fatin she puts it beautifully that the technology is not anymore our choice. That's a necessity of today. And on that question of the cost for the patient side, I think one of the things that we have seen in the recent times, the teleconsultation, has also helped reduce the cost on both the patient side as well as the provider side greatly. And with the insurance in different countries, the regulations accepting the teleconsultations for the reimbursement, etc., I feel that the cost of healthcare delivery can significantly reduced in multiple ways, even directly and indirectly. For example, if I need to drive for 1 hour, I need to take time off my work and have a 15 minutes consultation. And if that can be done on a teleconsultation from my office, then I might only take 15 minutes of that time, and I would be saving a lot on commute time as well as my time. Of course, the teleconsultation may not be appropriate for all type of problems, the healthcare problems, but most of the healthcare issues could be, I think, at least the first consultation could be teleconsultation. I think that would be a great help in reducing the cost.
Yes.
But let me here interrupt, because I have a vivid experience. For example, when it comes to second consultation with expertise worldwide, especially for x-rays, for example, we've been contracting on case-to-case basis, which reduced tremendously the cost for the hospitals, you know, and we can reach anyone through teleconsultations within the hospital or a second opinion, and through the technology, it tremendously reduces the cost versus having that expertise on staff. And we've been doing that for a while now, you know, when it comes to x-rays, for example, or even now we are thinking of experts to do surgeries, you know, and they are in Germany or the US, and they will, through the technology, without them coming, just to give second opinion to my surgeon. It helps a lot.
Yes.
Yeah, very true, Dr. Satan.
I think with the COVID-19 pandemic, people have started to use these technologies more because we haven't been able to travel. But I think people are realizing that it doesn't have to be just because of a pandemic. These things, the technologies are very useful, just generally. Okay. Anyone like to add something about the pandemic?
If you allow me, I think we also, I'm seeing a lot of changes in behavior of, patient coming to hospital. They require, information to get to them in a way that, say, if you're organizing the engagement or the appointment itself, you see a lot of dissatisfaction if they don't receive information. They don't want to ask for the information. They want to receive those information ahead of time. So they want to have awareness about where they need to wait, what they will need to do, how are they going to achieve those activities. And then they like to have the quickest way or quickest rule to get to the clinician. So managing that patient administration side is actually one of the key factors to increase satisfaction from the patient side. And I see a good value from that side if we could include those steps that each patient, when they go to that facility, they would look for. We see a lot of also, the new generation, and they want to be independent. They don't want to come with their, father or their, spouse. They want to navigate their way through the facility. So, having those empowerment to them by having a portal to engage it, not only for the medical side, but also for the administration side. I think that would give a huge boost in empowering the patient to navigate their treatment inside any facility. Thank you.
Yeah, thank you. Dr. Rahul, do you have anything to add on the subjects we've discussed?
No, just going back to the patient, because that is something which is close to our heart, every one of us. Reminds me of when I was doing my training, and in the NHS, there's a service called PALS, Patient Advice and Liaison Service. And whenever you used to walk through, there used to be this sort of a phrase, if you like, or which used to say, "No decision about me without me." And that is quite pertinent. I think that is the crux of it in terms of engaging the patients, that if we are taking a decision on a patient's condition, negotiated care, taking the patients with us along the decision journey is important. That would make a difference between a successful and a not so successful management plan, because if the patients are not aligned with you, your task and the patient's task for better health will get increasingly difficult and uphill. So that's probably the one thing that comes as a summary to me in mind. Thanks.
Yes, thank you. Yes, that's very, very important.
Yeah, that's beautifully put, Dr. Rahul.
Yes. Sorry?
That was beautifully put.
Yes. Yes. Thank you. Yeah, so empowering the healthcare providers and empowering the patients at the same time. Okay, thank you everyone for joining us. It has been a very interesting discussion, and I hope you all enjoyed it. The team at Medoment can be contacted through the HTWorks website, htworkslk.com, if you would like to find out more or send any inquiries. A special thank you to all our panelists, Dr. Fatun, Mr. Abdulaziz, and Dr. Rahul and Mr. Ajwad. And thank you to Medoment for organizing the webinar. Thank you, everyone.
Thank you, Vivian. Thank you.
Thank you, Vivian, for moderating. Thank you.
You're welcome. Thank you.